He was watching his iPad on the couch, and I can kind of tell like his words were getting a little slower. Then at that point, he just fell on the ground.
Then I just picked him up and just straight to the hospital.
We got transferred to Commerce Hospital that night. He had his biopsy, and it came back that he was positive for high-risk neuroblastoma.
We took her to the ER. They did an MRI. They found the mass in her brain.
Once we had the final diagnosis, basically they sat Chris and I down and was like, your kid has 9 to 18 months to live.
When he was 14 years old, he was feeling crummy, so I brought him to the hospital. 3 days into that, his doctors started seeing atypical cells show up, and those results came back with a very rare AML leukemia diagnosis.
In, I think, 2021 or 2022, I officially got diagnosed with a grade 2 astrocytoma in my brain.
They medically transported us to CHOP. We were doing a bunch of testing, and then 5 doctors walked in and said, we believe it's leukemia. Your life changes completely upside down in a matter of seconds.
Spring break of my sophomore year of college, I wasn't really feeling quite right. I eventually went to the Student Health Center where they could see in my blood counts that something wasn't altogether normal.
Martin was 19 when he was diagnosed, so he could either be treated as a pediatric patient or he could be treated on the adult level.
We've made a lot of progress in treating children with cancer, and we're of course extremely excited and proud of the progress that we've made. The fact still remains that in higher income countries, cancer is still a leading cause of death by disease in children.
What's exciting to me is that we have figured out through research that children's cancers are very different than adult cancers. And in knowing that, we appreciate that we have to look at pediatric cancer with different lenses to give us a sort of comprehensive picture of all the things that are driving that cancer.
Being told that your child has an incurable, potentially fatal disease, it was terrifying. Alex started Gomekli, which is a MEK inhibitor, in late July of this year. After the first month, we already had a reduction of 1 centimeter in his tumor, which doesn't sound like a lot, but is astronomical after 1 round of treatment. It was just amazing.
We went right in and we started intense chemotherapy. When the 3rd month came around, she still had 75.8% of leukemia still left in her bone marrow. And at that point is when Dr. Rangel said, you know, we have a very small window of opportunity here. The CAR T therapy has been less invasive. She has 0 detectable leukemia in her B cells right now from the CAR T therapy.
Tyler was on chemotherapy along with this menin inhibitor called revumenib. The only reason why Tyler is here today is because of revumenib and him being enrolled in the clinical trial.
So after the diagnosis, she actually had surgery to remove as much of the mass as they could. After they removed the mass, they came up with a care plan. And so she went through 6 weeks of radiation. Following that radiation, we essentially had a couple of options. The clinical trial that we ended up getting into, where she started making trips to Michigan about every 9 to 12 weeks.
She's been on OCT-201 and they haven't seen any recurrence or growth on her MRIs, and she's still taking it. She's been on it for 4.5, 5 years. OCT-201 has kept this demon at bay.
When I was 17, my oncology team presented me with this new drug called vorasidenib, which is supposed to slow down growth or potentially halt it entirely. I've been on it for about a year, and my neurosurgeon said it seems to be working. The growth seems to be slowing, which is really encouraging to hear, definitely.
The last thing you want to hear, that your cancer has come back. My doctor reassured me at the time that there was an option that was an immunotherapy.
Blincyto was our last chance. He had to tolerate it.
I see my doctors now about once a year. The visits are fairly boring. Being in remission, that's the biggest thing.
Epidemiologically, we understand that over the life course, there are health challenges associated with high-dose chemotherapy, radiotherapy. The ability to more precisely target with new drugs, we'll see a reduction of that long-term health burden.
He's doing great. He is thriving.
I think things have grown by leaps and bounds just over the last 10 years. And you would chalk that up to the research and all the trials with all those advancements.
To continue to accelerate the progress that we're making in childhood cancer, we need funding. Federal funding has been instrumental in advancing our understanding and our treatment of childhood cancer.
Now, thanks to the research and the government funding that we have had up until this point, we have 2 FDA-approved drugs to treat the type of tumor that can become malignant.
Funding for cancer research means, giving families and their children a fighting chance, not just for survival, though, for living a full and, a healthy life.
Ensuring that we have the proper funding and resources and people in place to support these programs is just critical. It literally saves lives.
If there was one thing that I could say to the people that are in charge of putting funding towards these kinds of things, it gives people who are going through something really difficult hope for the future.
We need the funding to keep moving forward, to keep getting to a place where you don't only have that one option.
I feel not scared anymore, and I feel a little happier.